If you've had multiple rounds of antibiotics to try to kill Helicobacter or H pylori and now you don't have the infection, but you still feel pretty terrible with signs like acid reflux, bloating, nausea, indigestion, food kind of sitting in your stomach and stomach pain, then this video is going to explain some options and some things that you can do to try and help resolve those problems. Now, if you've opted for the standard medical treatment of what they call triple therapy, which would be 2 different types of antibiotics, plus a PPI medication like omeprazole, or in some countries, they actually use 3 antibiotics, and the omeprazole, they call that quadruple therapy. Now, if you look at some of the science, it says the effectiveness can range anywhere between 70 and 90%. It really depends on the population and which part of the world they are studying. But if you've gone down that route and you've been tested again, and your test is negative, but you're still getting symptoms, there's a couple of things that could be the problem. The first one is that you still have the H. pylori bacterial infection. So you took the antibiotics and it didn't work, now you still have the infection, but you just can't find it in your standard test. The problem with the testing, endoscopy is probably the most accurate test that you can do, but you need to be off your PPI medication for at least 15 days. There is some literature that says you will get a 56% chance of a false negative if you are on omeprazole in the 15 days leading up to your endoscopy. Stool testing, breath testing, blood testing doesn't seem to be very accurate. I've worked with countless numbers of people who said they didn't have it, their tests were negative, but they took some Pylopurge herbs to kill the H. pylori and they felt so much better. So I think there's a twofold problem here. 1, you still have it and it's not show up in the testing, and 2, the testing is just not very accurate. So in a case like that, if I was working with you, I'd probably try the herbs in Pylopurge. I think it would be a bad idea to keep hammering your microbiome with more and more and more antibiotics, because remember, every time you take an antibiotic, it will damage some of the beneficial bacteria that live inside your mouth, your stomach, your bowel, and sometimes those bacteria cannot be found again. If you kill them, that's it. You can't put them back in. Things like Oxalobacter and oxalate degrading bacteria, once they've been killed by antibiotics, that's it. We don't have a probiotic form that we can add them back in. So you have to be very, very careful when you overuse antibiotics, especially if you've tried it and it's not worked. The second problem that you can have, and I think this is probably one of the biggest reasons people struggle when they take antibiotics, is that you've killed the H. pylori infection, but also now you've killed a lot more of the beneficial bacteria inside your system. So you can think of it like this: if your H. pylori levels are here and your other beneficial bacteria levels are here, if you take antibiotics, you reduce both levels. So now you end up with the same problem. It's the ratio of H. pylori compared to beneficial bacteria that is the real important stat here. Remember, Helicobacter or H. pylori is a commensal part of microbiome. So it is part of a lot of people's microbiome. In fact, the science says that we think half the world's population has H. pylori, but not everybody suffers. So what you may have done is you've reduced your beneficial bacteria populations as well as killing the H. pylori, but you still have more Helicobacter relative to the beneficial bacteria that is supposed to keep it in check. And again, I would try here a combination of 2 things. I would take some Pylopurge to kill the H. pylori, but I would also take some beneficial bacteria that we know specifically work inside the stomach, such as Lactobacillus reuteri, DSM 17938, which you can find in the probiotic called BioGaia Gastrus. And finally, there could be a completely other reason that you still have symptoms, such as a yeast overgrowth. Now, it's my opinion that yeast is probably the second biggest cause of acid reflux that goes completely missed by a lot of people and their doctors. Here's the problem when you take antibiotics. You've reduced the beneficial bacteria, and now the yeast that was normally kept in check by that bacteria, very similar to the way H. pylori is now overgrown. So now you have more yeast relative to the amount of bacteria that you should have. And again, in a scenario like that, I would take the yeast purge capsules that will help to reduce that amount of yeast, bring you back into balance, and that should solve your problem. Hopefully this was helpful. If you like these tips, please subscribe and follow on.